Welcome to Section 10 of Neurology. In this section, I'll be discussing the ventricular system. Let's get started. This is figure 8.50, which provides an overview of the ventricular system. For step 1, you need to know that all of the ventricles are lined with special cells that produce cerebrospinal fluid, or CSF. When there are a group of cells that do this, it's referred to as the choroid plexus. Notice the arrows from this figure which map out the flow of CSF. From the lateral ventricles, CSF moves through the interventricular foramina of Monro into the third ventricle. Notice the interventricular foramina of Monro right here. Once in the third ventricle, CSF moves into the fourth ventricle through the cerebral aqueduct, which can be seen right here. At this point, the CSF moves into the subarachnoid space through the foramen of Magendie and the two lateral foramina of Luschka. Okay, with this in mind, let's look at a mid-sagittal view of the brain to see where the CSF goes after moving into the subarachnoid space. This is figure 8.51, which provides an overview of the normal flow of CSF. From the last slide, we showed that the CSF had just moved into the subarachnoid space through the foramen of Magendie and the two lateral foramina of Luschka. After passing into the subarachnoid space, the CSF enters the venous system through the arachnoid granulations, and these drain into the superior sagittal sinus. Okay, before we move on, I'd like to briefly mention that the area postrema is located near the floor of the fourth ventricle in the medulla. So the fourth ventricle is right here. So the area postrema is at the floor of the fourth ventricle, about right there. This area is an important region in the brain responsible for inducing vomiting. If the ventricular system is obstructed, excess CSF will accumulate, which can cause several pathologies. Another name for excess CSF is hydrocephalus. For step 1, you need to be familiar with 3 types of hydrocephalus. This includes communicating hydrocephalus, non-communicating hydrocephalus, which is also known as obstructive hydrocephalus, and hydrocephalus ex vacuo. Communicating hydrocephalus is pretty straightforward. Communicating refers to the idea that the ventricular system isn't directly obstructed. Rather, the arachnoid granulations are obstructed. In this sense, the ventricles are able to communicate with one another, hence the name communicating hydrocephalus. This type of an obstruction results in dilated ventricles and increased intracranial pressure. So increased pressure. Non-communicating hydrocephalus refers to the idea that there is an obstruction within the ventricular system. In other words, the ventricles are not communicating with each other, hence the name non-communicating hydrocephalus. This type of an obstruction also results in dilated ventricles and increased intracranial pressure. So increased pressure. Finally, hydrocephalus ex vacuo refers to the idea that the ventricular system is enlarged due to decreased brain tissue rather than an increase in CSF. This could occur, for example, in a patient with dementia, which results in cerebral atrophy. In this case, the intracranial pressure would be normal because there is no obstruction within the ventricular system. So, normal pressure. Okay, with this in mind, let's briefly review the dural venous sinuses. This is figure 8.52 from your text, which clearly shows the meninges. Recall that the meninges are the 3 membranes that surround the brain and spinal cord. From superficial to deep, these include the dura mater, the arachnoid mater, and the pia mater. Notice from this image that the dural venous sinus is right here. This is formed by spaces within the dura mater. Dural venous sinuses are important because they receive the arterial blood and cerebrospinal fluid and allow the brain to remove its waste products from the cerebral circulation. Okay, with this in mind, let's look at figure 8.53. This is figure 8.53 from your text, which shows a lateral view of the dural venous sinuses. I'm not going to read each of the sinuses to you, but take a moment to become familiar with this image. For step 1, it's most important to be familiar with the superior sagittal sinus and the cavernous sinus. The superior sagittal sinus is important because it receives CSF from the arachnoid granulations. The cavernous sinus is important because it contains cranial nerves 3, 4, parts of 5, 6, and the internal carotid artery, which we've talked about in previous lectures. Notice how several sinuses, as well as the ophthalmic veins, drain into the cavernous sinus. This is clinically important because infections of the eye can spread to the ophthalmic veins, which can travel to the cavernous sinus and spread throughout the brain. This is figure 8.24, which shows a coronal view of the cavernous sinus. Again, notice that cranial nerves 3, 4, parts of 5, and 6 all traverse the cavernous sinus. We can also see the internal carotid artery right here. Okay, with this in mind, let's do a few questions. A 2-week-old boy presents with bulging fontanelles and papilledema. His history is significant for bacterial meningitis, which was promptly treated and appeared to have resolved several days ago. What is the likely cause of the patient's symptoms today? From the question stem, we know that the patient has bulging fontanelles and papilledema. These are both signs that there is increased intracranial pressure. We also know that the patient had meningitis that has since resolved. For step 1, it's important to know that meningitis can cause scarring of the arachnoid granulations, which disrupts their ability to absorb CSF. The reduced ability to absorb CSF results in an accumulation of CSF in the ventricular system, which results in increased intracranial pressure. So again, the decreased CSF absorption results in increased CSF in the ventricles, which results in increased pressure, which results in papilledema and bulging fontanelles. Recall that when the arachnoid granulations are obstructed, resulting in excess CSF, we call it communicating hydrocephalus. From figure 8.51, we can see that obstruction of the arachnoid granulations would prevent the proper circulation of CSF, resulting in communicating hydrocephalus. Okay, let's do another question. An MRI of the brain shows enlarged lateral ventricles and an enlarged third ventricle, but a normal-sized fourth ventricle. What structure is obstructed, resulting in the MRI findings? From the question stem, we know that the patient has enlarged lateral ventricles and an enlarged third ventricle, but a normal-sized fourth ventricle. Hopefully from this description you were able to deduce that there is an obstruction between the third and fourth ventricles. Let's pull up an image so you can see what's going on. From figure 8.50 we can see that the cerebral aqueduct drains CSF from the third ventricle into the fourth ventricle. Because our patient has a normal-sized fourth ventricle and a dilated third ventricle, we can deduce that the cerebral aqueduct must be obstructed. Recall that a structural block within the ventricular system is called a non-communicating hydrocephalus. So our patient has a non-communicating hydrocephalus due to obstruction of the cerebral aqueduct. Okay, before we move on, I'd like to mention that it's incredibly high yield to know that the pineal gland sits directly posterior to the cerebral aqueduct. And this is a common cause of this type of obstruction. This could occur, for example, in patients with pineal gland tumors. So remember, the pineal gland can cause an obstruction of the cerebral aqueduct because it sits just posterior to the cerebral aqueduct right here. Okay, let's do another question. A 67-year-old female with Alzheimer's disease received a routine MRI, and the radiology technician noticed the patient had extremely large ventricles. What is the most likely cause? Okay, pretty straightforward. Hopefully you notice that the patient has Alzheimer's disease, which should immediately make you think of cerebral atrophy. The decreased brain tissue rather than an increase in CSF is what causes the ventricles to appear dilated on imaging. Recall that this type of hydrocephalus is called hydrocephalus ex vacu. So again, hydrocephalus ex vacu is due to decreased brain tissue rather than an increase in CSF. Okay, let's do one more question. A 2-year-old boy has an infection of the eye. The physician is concerned that the infection may rapidly spread to the cavernous sinus. Through what structure would this be possible? From the question stem, we know that the infection may spread into the cavernous sinus, and we're asked through what structure this would be possible. Recall that the ophthalmic vein drains directly into the cavernous sinus. So again, infections of the eye can spread to the cavernous sinus through the ophthalmic vein. The physician is concerned about spread to the cavernous sinus because then the infection could spread throughout the brain and become much more life-threatening. From figure 8.53, we can see that the ophthalmic vein receives blood from the eye and drains directly into the cavernous sinus.